So my name is Dr. Cassandra Wright, and I'm a researcher from Menzies School of Health Research in Darwin. I'm an alcohol and drugs researcher with an interest in how policies impact on priority populations. And we did this research to try and understand the way that alcohol companies and lobbyists use evidence when they're trying to influence alcohol policies. We used policy submissions into the National Alcohol Strategy as a case study because it's such an important policy document that sets the agenda for alcohol policy for about a decade. So we found that submissions from alcohol companies and lobby groups consistently promoted non-evidence-based and ineffective policy measures, and that they downplayed the social and health harms of alcohol. And the research also showed that the industry deliberately misquoted, manipulated, misused, and ignored evidence throughout their submissions. So examples include making unsubstantiated claims or omitting newer, higher quality research to favour old or low quality studies when they were trying to back up what they wanted to say. It was really clear across the submissions that alcohol companies and lobbyists want the public and policymakers to be confused about the science, even when the research is clear. Our research shows that alcohol companies distort the science around alcohol and policy to try and influence policy in ways that protect their profits. And this really muddies the water for governments who are trying to make decisions that are in the best interest of the community. I think it begs the question of whether alcohol companies should be allowed a seat at the table in these policy processes. We know these tactics are borrowed straight from the big tobacco playbook, and recognising these tactics has led to better protections of public policy from tobacco companies. So we see this as a model that we want to see implemented for alcohol too, that will prevent the alcohol industry's attempts to undermine evidence-based public health policy through these inaccurate submissions and claims. And until then, we need really close scrutiny of alcohol industry submissions into policy and strategy consultations. So we want to help governments make informed decisions about policies that protect communities from alcohol harms. And part of this means understanding commercial influences on health, well-being, and policies. So we hope our study is useful to these governments who are trying to make sense of all of the different information they receive.